Hello, welcome to our Total Joint Replacement online education class. Thank you for choosing TriStar Greenview Regional Hospital for your orthopedic care. We have created and designed an orthopedic unit specifically for your care. Our goal is to provide exceptional care from pre-op care to recovery. You are scheduled for a joint replacement surgery, and we are here for you every step of the way. In this video, you will learn what to expect before, during, and after surgery. We will walk you through the process from admission to discharge. Our goal is to have you return home ready to accomplish your orthopedic goals. A total knee replacement is a surgical procedure used to resurface a damaged knee. Metal and plastic parts are used to cap the ends of the bones that form the knee joint. Most people who have a total knee replacement experience a reduction in pain and a significant improvement in the ability to perform common daily living activities. In a total hip replacement, an artificial ball replaces the head of the thigh bone and an artificial cup replaces the worn socket. A stem is inserted into the thigh bone to keep the ball in place. The parts are connected to create a new artificial hip. A plastic liner is placed between the metal ball and a cup to create a smooth surface for comfort and movement. The objectives for our total joint class are the following: what to expect during your hospital stay, the role of your coach, pain management, physical and occupational therapy, discharge planning, setting expectations, goal setting, easing fear, and answering any questions you may have. At TriStar Greenview, we have a dedicated orthopedic unit. It is located on the 5th floor. We believe family is important in the healing process. Currently, visitors are screened at the front door at entry. One family member may accompany you during your stay. Orthopedic unit highlights include breakfast at 8 a.m., lunch at noon, and dinner around 5 p.m. Guest trays may be purchased for $8. You can enjoy free Wi-Fi by simply connecting to our guest access from an internet browser on your phone or device. Throughout life, we have many different coaches that help us succeed. Your joint replacement surgery is no different. Your coach can be a family member or a friend who provides motivation, builds confidence, and offers support and encouragement. They are an active member of your orthopedic team. We encourage your coach to participate in your daily activities while you are here with us. At Greenview, we believe in a team approach. Our team starts with you and your coach, along with the clinical team. Your clinical team consists of orthopedic nurses, nursing assistants, case managers, physical therapists, occupational therapists, as well as our leadership team. Prior to surgery, take some time to prepare your home. We suggest the following: remove all rugs, place nightlights in bedrooms and in bathrooms, practice using your walker, keep stairs free and clear of clutter, prepare meals in advance if possible, make arrangements for animals and transportation after surgery. We suggest having assistance at home for the first week. In your total joint replacement book, you will find pictures of exercises for total hip and total knee replacement. Prior to surgery, please review your exercise list. If they cause pain, please do not do them. These exercises will be performed after surgery by your physical therapist. Prior to surgery, you will have a pre-admission testing appointment. Please pull in the front of the hospital at one of the numbered parking spots. Call the number listed on the sign, and your pre-admission testing nurse will give you further instructions. Your pre-admission testing appointment should take approximately 1 hour. The medical staff will review your medications along with your health history. Physician's orders such as EKG, COVID swab, medical consents, and labs will be drawn at the appointment. Anesthesia will provide information on the types of anesthesia used, information on enhanced surgical recovery, and our total joint replacement book will be given at this appointment. The night before surgery, please make sure to follow the ESR instructions given to you at pre-admission testing. Shower with the CHG solution that was provided. Your sheets should also be changed once you have showered. Repeat this step in the morning prior to arriving at the hospital. Remove all nail polish, shellac, and artificial nails prior to coming to the hospital. Do not shave your surgical area. Remove all jewelry and body piercings. Remember, no solid food after midnight. Please start your Ensure carbohydrate drink on the way to the hospital. This pre-op drink should be finished by the time you arrive at the hospital. What to bring the day of surgery. We suggest bringing comfortable walking shoes with a good rubber sole, loose-fitting, comfortable clothes, personal hygiene items, insurance cards and identification, a positive attitude, and your orthopedic goal. If you require a CPAP or a BiPAP machine at night, please bring your machine as well. Please label your walker prior to your surgery. We ask that your family keeps all personal belongings in the car until your surgical procedure is over. Once you arrive on the orthopedic unit, your family can bring your walker and your personal items to your room. On the day of surgery, the same-day surgery nurse will prepare you for surgery. The nurse will complete the following: assessment, CHG bath, vital signs, IV placement, and will give any medications your physician has ordered. We ask that family leaves a contact number for your surgical team. During surgery, the surgical team will update your family. They will be notified when the procedure starts, every hour you're in surgery, and once you are moved into the recovery room. The surgeon will also contact the family. Once your surgery is completed, you'll be taken to the post-anesthesia care unit. Here you will wake up from surgery. You will be assessed and treated for any nausea or pain by your nurse. Once you have recovered from anesthesia, your recovery nurse will call the orthopedic nurse to give report. You will then be taken to the orthopedic floor by your bed. You will be in the recovery room for at least 1 hour after surgery. The orthopedic floor is located on the 5th floor of Greenview Regional Hospital. Once you are transported to your room, your family may join you at this time. Communication boards are located in each room. These boards will be updated each shift by nursing. The board will provide the names of all your team members, family contact information, orthopedic goals, estimated discharge dates, plans for the day, pain scales, pain management goals, and your next available time for pain medications will be listed. Please refer to this board for information during your stay. Your nurse will complete an admission assessment once you arrive on the orthopedic floor. Your assessment will include monitoring vital signs once an hour for the first 4 hours. Your pain and nausea will be monitored as well. We will resume a diet as ordered by your physician. Orthopedic equipment could include ice packs, feet and leg pumps, drains, IVs, or braces. The equipment ordered by your physician will be applied by your nursing staff. Pain is controlled with various medications and modalities by your orthopedic team and your surgeon. Your pain goal should be for manageable pain. Manageable pain is the ability to participate in physical therapy and daily living activities. Some pain should be expected with any orthopedic surgery. Your physician will schedule medications such as Tylenol, Lyrica, or gabapentin if you're not allergic to them. Our team will also be moving you early and frequently. Ice therapy is used to help control pain and swelling. Narcotic pain medications will be prescribed on an as-needed basis. Your nursing staff will list your medication name and the time it's available on your communication board. Pain pills are used after surgery to aid in manageable pain. If you need medications, please notify your nursing staff 15 minutes prior to the time listed on your communication board. Your pain is specific to you. We suggest taking pain medication prior to all physical therapy sessions if it is available. Please let your nursing staff know if your pain is not manageable. Orthopedic surgery is a very active recovery. The enhanced surgical recovery protocol aids in this process. You will be assisted to the chair for all meals. This starts at 6 a.m. on the orthopedic floor. Physical therapy will see you the day of surgery and see you twice a day. They will teach lower extremity exercises, range of motion, strengthening exercises, and stair training. We ask that you do not get out of bed by yourself. Please call the nursing staff for assistance for your safety. Your orthopedic team will evaluate you on an individual basis and let you know if you are safe to walk without a staff member. Our total knee patients can expect to walk with physical therapy twice a day and perform the exercises that are shown here. Our total hip patients will also work with physical therapy twice a day and perform the exercises that are shown here. Occupational therapy will see you during your stay. Our therapists will focus on independence with bathing, grooming, and self-care, along with providing safety precautions. Our therapists will see you once a day. Discharge day is a very busy day. Your day will include visits from our nursing leadership team, case manager, nurse navigator, and physical therapist. Most of our patients are discharged home the day after surgery. Please have your ride available to pick you up by 12 p.m. On discharge day, your nurse navigator will provide the discharge instruction booklet. The booklet covers information on what to expect at home, pain control, infection prevention, home safety, and when to notify your physician. Nursing will provide a copy of all discharge medications, prescriptions, and follow-up information. On discharge day, our case manager will visit. Our case manager will assist in setting up services outside our facility. Most of our patients discharge home the day after surgery with home health or to outpatient physical therapy. If your physician feels you need inpatient rehab, we will assist with setting up those services. It is important that you are safe when returning home. Your discharge goals include climbing and descending stairs if necessary. Your pain must be controlled with pain pills. You should be able to walk at least 100 feet with your walker, and you should be able to get in and out of bed on your own. Physical therapy will help evaluate these goals. Like in any surgery, there are risks with total joint replacements. DVT, or a deep vein thrombosis, and a pulmonary embolism, or a PE, are risks for orthopedic patients. Your physician will order various modalities and medications to help prevent these from occurring. Medications such as aspirin or other blood thinners will be used. Walking early and often after surgery, along with the use of foot and leg pumps, will be a part of your treatment plan. A DVT is a clot that forms in the deep veins of your body, usually the legs. Symptoms can include pain in the limb, severe pain in the groin, behind the knee, or calf. This area could be warm to touch. A PE is a blockage in the artery of the lungs. Symptoms can include chest tightness, shortness of breath, unexplained anxiety, wheezing, or coughing up blood. If you were to experience any of these symptoms, please contact your nursing staff immediately. A DVT or a PE are emergency situations. After discharge, if you have any of these symptoms, please go to the nearest emergency room or call 911. We strongly suggest eating a well-balanced diet and not smoking to aid in healing. Your physician will release you for activities such as driving and returning to work at the follow-up appointment. If you have any questions or concerns after surgery, please contact your physician during office hours. Your orthopedic surgeon will see you in the office 2 weeks after discharge. At this time, your surgical site will be evaluated and any staples that are present will be removed. Please remember that swelling, pain, bruising, and redness are all common the first week after surgery. It is highly important that you fully participate in physical therapy for optimal orthopedic results. Thank you for choosing TriStar Greenview Regional Hospital for your orthopedic needs. Our team looks forward to helping you achieve all your orthopedic goals. If you have any questions, please contact Heidi Simpson, Orthopedic Nurse Navigator, at 270-793-3232, or Brian Fisher, Director of Orthopedics, at 270-793-3233.